I'm Dr. Demetrio J. Aguila III. I'm a peripheral nerve surgeon, I'm an ear, nose, and throat surgeon, and I'm also a plastic surgeon. I'm the host and founder of the Direct Care Movement podcast, where we dive into the intricacies of direct care, whether it's direct primary care or direct surgical care. You can find out more about what this movement is and where it's going and where it came from. I have the great pleasure today of having with us Dr. Torres Hodges. Grace, how are you doing today?
I'm doing fantastic. Thank you for asking, awesome. Demetrio.
Yes. So let's start. Why don't you tell us a little bit about yourself, a little bit about your practice, and a little bit about how you got into direct care?
Sure. I am Grace Torres Hodges. I'm a podiatric surgeon practicing in Pensacola, Florida. I've had a solo private practice since 2001. And in 2013, right about the time that the Affordable Care Act was coming to full fruition, I got this email from a group that advertised that they wanted to thrive, not just survive the upcoming changes of Obamacare. I went to this one-day meeting in Dallas and was completely hooked on the idea that, I was told that in order for patients to see me, I needed to be on insurance plans. And at that time, there were more and more regulations being put in. After that meeting, where I'd met specialists, because this has been a movement among primary care for some time ahead, but specialists that were there from ophthalmology, general surgery, ENT, dermatology, and then myself, I got under their wing, and for the last, I've been 10 years in direct care. I've dropped all insurance companies, including Medicare. We can go into that later because a lot of people always ask about that, considering I'm a very heavy geriatric population. But at any rate, since that time, not only have I been thriving, I've been mentoring other doctors to get out of it. I took those notes and put it into a book. So I have one book out there right now called Private Practice Solution. It won 2 awards in business and medicine and has been inspirational for doctors to find, just to kind of get reassured. I think a lot of it, we know what to do. We just want to make sure that we're not thinking out of the box too much, and that there are other people that are in this. And it was good to see and meeting with other people, particularly through organizations like the Free Market Medical Association, which I'm sure we'll talk about here as well, that like-minded people are out there. You just need to find them. But this is not a change in the way that we do medicine. It's just a change in how we interact with the system. And then something that you may not know, I have actually another book coming out geared now not to practicing physicians, but to students and residents. Because over the last 25 years, I've been teaching and roundtabling with students. And the question always is, what are you going to do afterwards, after residency? And it used to be hang a shingle. Now it's now I'm going to join a group. I'm going to be employed by the hospital. But at first it may seem like an easier route to go that way, but in the end, it's an intermediary between you and the people that you're supposed to be taking care of.
Right. So how did this book come about? I mean, obviously your original book is really popular. I have an autographed copy of it. I'm very proud to say, also for that. And it's obviously been a great resource for people who are in practice. How did this second book come about? Tell us more about that.
This second book came about when we were at the Free Market Medical Association, probably about 3 years ago. It was during the 10th anniversary. We had about 150 medical students over there, and I had a chance to just talk with them. And again, we have a lot of residency programs here in our town, and so I've had an opportunity to reach out to them as well, and just kind of like, it's like pizza and pictures. I take it from the way that Keith Smith over in Oklahoma had done with the medical students over there. And so students and residents always want some free food, but also just the guidance. And I think they're scared to ask. It's a very non-confrontational way because they're not trying to get in on a case, although I'm always open to having them, shadow and come in on cases and everything like that. But this is completely out of the normal things that they're learning in school. I did a LinkedIn survey on my profile, and the overwhelming 56% of people said this needs to be in the medical school. I actually reached out to the deans within some of the schools that I have worked with some of their students. And what the answer came back, that's really good. Oh my God, that's great. And I'd get an opportunity to talk to like a small group, but then they go, you know what? Well, we have a business school with our college, and and I hate to say it this way, I get it from their perspective as a university. You want students to get into your business school and enroll there because that's a tuition revenue stream. But what they're learning in business school, which, by the way, I have a business degree, so I understand it. And I got it after I'd been in practice already, because I wanted to hone in on what we actually need in our day-to-day and having lived through it. But now when I talk to students, I started meeting with them online, and like quarterly would meet with just a group of students, and it's kind of word of mouth. So from that, the questions that came about from there were really simple things. It's like they want to know, how does the paycheck work? So how does my paycheck actually, I get a check, when you're a resident, and then, it's even just like basic financial literacy. And maybe it's partly the mom in me, and this whole group of kids that are coming out right now are my children's age. So this is, I'm not trying to mommy, but I am trying to guide. And I think we owe it to them to give them truly, and this is the big one, informed consent. We are supposed to be the masters of informed consent, especially those of us that do procedures. We give them all their risks and complications. We give them all their options, including not to treat. Well, the same thing should be the case also with us in medicine. We don't have to go into third-party payers. We don't have to be working for someone. You can hang a shingle, and you can work one-on-one with patients. And so that's kind of roundabout how it came about, just talking.
And so that's really what it's all about, isn't it? I mean, it's about informed consent for the doctors and informed consent for the patients, right? Tell us a little more about that concept.
Well, and I think we always go into informed consent and only talk about clinical things, and talk about, because we're so geared towards codes and procedures and everything like that without really knowing what the price of things are. A great example of this is imagine going to a grocery store and buying things with no prices. And that's basically what you're doing when we give our card and have it run through the insurance. The bad thing is, and Marty McCary said this great at one of the meetings. He said, insurance companies are both the pyromaniac as well as the firemen that are trying to put it out. So, it's it really can be simple. And sometimes we get into all the minutia thinking it's got to be complicated, but it really doesn't. I think for me, and I think for you also, the fact that we have these relationships, it comes down to relationship medicine. You have a relationship with your patient because they have entrusted you, which is such an honor and also a responsibility. You want to do what's best for them, their best interests, both clinically and now financially.
Sure.
Yeah.
So now, and I'm glad you brought up the book. So that the majority of our audience, our target audience here, is medical students and residents and people who are fresh out of their training, as well as a bunch of other people as well. And apparently, there's a growing number of businesses that have been listening and watching this podcast, saying, "Hey, I might get something out of this too." But keeping in mind that a large percentage of our listeners and viewers are medical professionals who are at various stages of their training. I'm sure you've piqued their interest, and you've already gotten them to say, okay, so you got us interested in the concept. Let's step from concept into implementation.
Right.
So, what are the kinds of practical questions that your book addresses that are typical of people who are in training, who aren't yet out in the workforce, who are thinking about whether or not this whole direct care approach is for them?
Right. Well, first off, it's a choice. Direct care is not being pushed. When I even talk to people about it, I just want students, residents, and practicing physicians to realize that this is an option out there. You may not want to be an entrepreneur. And if you're not, do not go into direct care. Then work for somebody. But no one has to. I mean, there's a separate issue here when we're talking about third-party intermediaries and insurance. That's a completely different thing. But for when we're talking about ourselves and just our sanity of being able to practice with alignment that's geared towards what we want, but also for what is best for our patients. I'm looking at it very simply, just like that. And I think one of the things is that when we're in school, there's this like hierarchy of things that happens. When we're in school, everything is geared towards getting you through the curriculum and also learning as much as you can. Your focus is very take from there, because you're wanting to learn as much information, soak it in, and the interest there is the same because you're learning good medicine. I mean, you can't deny our clinical training in the States compared to other places. That's why a lot of people come here, both in schooling and also in the residency and fellowship programs. But then when you get into the hospital, which all residencies are always affiliated with a hospital entity, now the incentives are a little bit different. Yes, you're still there to learn, but the people who are employing you through the hospital have a different incentive also, because they are trying to churn through as much as they possibly can through there. So now you start seeing a disconnect of it. They're still wanting you to do well because they want the program. And my book covers things like the reason why they like the programs because they get Medicare monies from it and graduate medical education. There's all this like intertwined, it's a big spider web of things. And so there's still an incentive to push you forward as a student and as a resident, to have you learn. But there's an alternative incentive when you're looking at numbers as far as finance for the hospital. Then when you graduate, you're on your own. And that's the scary parts. And we are such an apprenticeship training in the fact that we see one, do one, teach one. And I think for such a long time, the see one, do one, teach one was good, because at the time when insurance originally got used, it was used the way it was supposed to be. It was used in order to protect people from catastrophic disarray, from financial catastrophe, from expenses. But then again, it was also paid properly. Again, a totally different conversation. But I think that's where I'm very deliberate when I talk to students. I say, when you're in school and when you're watching and observing your attendings and your senior residents, learn and sponge as much as you can and learn what to do. But it's just as important to learn what not to do. You take advantage of every opportunity. I think that students tend to be scared. Oh, we went through all of it, especially in surgery programs. You want to be able to get first assist on cases as much as possible. So you basically kiss up to the doctors as much as you can. I think there's been a change in that. I think a lot, especially those of us that are in direct care, we don't do it that way. And there's always been an underlying thing. And I think because we're second generation doctors, we know what it was like to practice the way it was. When we both were hired, not hired. We were pushed to work in the offices to learn. You learn not just how to run the business, but you also learn how to create that trust factor with your patient. And we're getting back to it, I think, now. I can tell you, in the last 10 years since I've been in this, it is a huge change. And I think a big credit to just educating people out there, not just our students, not the practicing physicians, but the community, like you said. So I'm very excited. It's a really good time for this.
Yeah, for sure. Well, we've definitely seen some pretty significant growth in interest here in the Nebraska region. Because as you know, I'm the chapter leader for the Nebraska chapter of the Free Market Medical Association, and we've had enormous growth. We started out with 6 people attending our chapter meetings, and we've had in the 50s now.
Oh, that's awesome.
And which is amazing, and a greater diversity of people. We have physicians, we've got imaging centers, we have employers, we have a bunch of brokers and TPAs. For those of you that aren't that familiar with direct care, a lot of these terms I just used may not be all that familiar, but I'd encourage you to watch some of the other episodes so you can find out more about what those terms mean. But the bottom line is the people that are involved in the financing and the delivery of healthcare, with the exception of the insurance companies and the hospitals, are largely very interested in this movement and have been really, expressing their interest by showing up for these meetings. And so along those lines, we got a conference. You and I were talking about this before we started the recording. This year we don't have a national conference for the Free Market Medical Association. And so we figured here in Nebraska, why don't we, have our own conference and invite whoever wants to come. So this is my formal invitation to you, Grace, to come to the Nebraska FMMA meeting, which is going to be on the 21st of August here in Omaha. I'll send you the formal invite, and we're going to be posting that information on LinkedIn and a whole bunch of other platforms. We want to get as many people as we can. And you and I were talking before about the Benjamin Rush Institute, and I know you've got a really close relationship with them, so I'd like to talk about that a little bit. Obviously, we both agree that the way to really see the direct care thrive is to plant the seed early. Plant it in the medical students, get them to ask these questions and to say, you know what, wait, you mean working for the hospital isn't the only way? I was told that's the only way to practice medicine. And, planting that seed and getting them to ask questions that maybe they didn't know they could ask or didn't know that they should ask or didn't know that they were allowed to ask is really a big part of what we're trying to do by partnering the FMMA with the Benjamin Rush Institute. So could you tell us a little bit more about the Benjamin Rush Institute?
Sure. The Benjamin Rush Institute, I've been adjunctly involved with them since I joined FMMA. And I think I always kind of gravitated towards teaching and to students. But they have multiple chapters at all of the medical schools. And it comes in ebbs and flows. And, we get it. Typically these are second, third, and fourth year students that it's a club. It's a chapter at the school, and they invite or have options in order to have practicing physicians come in and talk to them, to teach them these business and economic side of medicine. I can tell you and it was hard before because the chapters, you actually had to physically get out to all of them. Now, with the advent of online everything, we can do a lot online now. And every year, the FMMA has been sponsoring students to come to the national conference because there's something just magical about having all these doctors that are so, first off, they're just happy. That's the one thing that they always say. They go, you guys are just so happy all the time. We love what we do because we're doing it the way we want to do it. I'm not hearing about the reimbursement rates are low, or that the 7-minute visits, that's all we're allowed to see. And that the scribing, the EMR, all of the pains that they hear. And unfortunately, what I found is the third and fourth year students now, they're scribing half the time, and they're not even in the exam room during rounds. Yeah, they do rounds, but they're the ones just scribing the entire time. And that was such an important thing that you have to learn. You have to see it. You have to feel it. You have to teach it. But they have chapters at all the schools. The problem that I think we've been running into with the chapters, and I did some with some of the Florida schools here, was that they graduate. And then they get into residency and they don't. So I think they've got a new executive director this year, Brian Mew. He's working on new programs that are a little bit more innovative. Definitely going to continue working with them. A lot of what I'm doing with the book, I was so grateful that the founder of the Benjamin Rush Institute did the foreword for my book. So,
awesome.
I think there's definitely a need out there. I would love to see this get into just one of those must read in school. It may not be a curriculum thing, but it's one of those to just have on hand all the time. And I made it small enough so it fits in your pocket, in your white coat. So it should do that. But yeah, so hopefully just ask around. If you're not familiar with it, go to Benjamin Rush online. I think it's bri.org. And, reach out over there. We're just trying to reach out to the students because I get it. They do lose a little bit of interest through there because they graduate. And so We're just trying to find a way to make it more cohesive, maybe expand it out. a little bit more. But with the new executive director, I think we're going to have some new activities with it.
Sure. So my introduction to the Benjamin Rush Institute was, I don't remember how many meetings ago it was, but a number of years ago, we had like 80 something medical students.
The tenure thing.
I might have been
Yeah,
one.
yeah.
And they all showed up, and I was like, holy cow. I mean, it was like, I think it was 1 out of every 5 attendees at the conference that
Right.
year was medical students.
Right.
And almost
That was
all
so
of them were
awesome.
there because they'd been sponsored by the Benjamin Rush Institute. So, as I recall, the cost to the students was, if it
Nothing.
wasn't zero, it was
Yeah.
pretty close to it.
Well, so this is one thing to reach out to practicing physicians. Donate. You can sponsor a student. That's what I do every year. And actually, all the proceeds from my books, that's what it goes towards. So I sponsor students to this. So I encourage you to look there, sponsor a student, because that's the only way that we're going to get the word out there. You can see that there's a lot of institutional things that are trying to like fight against it.
Right.
Like I said, the business schools at the colleges, but with the combined degree, that's what they want them to get. But yeah, and the students are loving it. And some of them, the last meeting that we went to, we just informally, there were 4 of us. I think it was Dr. Bagaris and Dr. Concepcion and,
Right.
and me, just kind of an informal in the hallway conversation. And we just, all these kids gravitated to it. And
Yeah.
it was awesome because they were just asking, well, how do you do this? How do you do this? How do you do? And if we had that when we were at that age, I think we would have taken a little bit of a different path
Sure.
towards things. So
For sure. So let me ask you this as we're wrapping up here. What is, right, again, keeping in mind who our target audience is. And I'm glad you brought up, if I had these kinds of resources when I was at that stage of my training, if you could talk to yourself at that stage, like as a student or as a resident, what would be the most important thing you would tell your younger self that would potentially change the course of your career?
I'm going to actually, I think it's very much keep boundaries. I think that's the biggest thing. My opening chapter in the book is about values. You go into medicine with a set of values of why you went into medicine and remembering what that why is for. Because there are all these things that you're going to get exposed to that's going to make you question whether your why is worth it. It's a hard thing for any of us, even those of us that are still practicing, to keep boundaries. You are not going to save everyone, but the most important person that you have to save is yourself. Because otherwise, there's that great phrase, an empty vase has nothing left to pour. And unfortunately, that's burnout. That's moral injury. That's all the things that we hear about with it. I think if doctors will remember what their why is, and then Simon Sinek has that whole book out there, great book, by the way, to reference to. I taught my book that's coming out. That's another one to look at. And there's another book that I reference to. It's by Jacques Philippe. It's Interior Freedom. No one can make you change your mind unless you allow it to do that. So control what you can, and keep your boundaries and know your why. I still have to remind myself of that.
Sure.
Uh-huh.
And then lastly, from a practical standpoint, for a medical student, let's say, who is curious about this, what are the first 3 steps toward getting into direct care as a beginner? What are the first 3 practical steps?
I think number 1, get involved in learning again what to do, or what you're sponge as much as you can of learning how to do things, but also how not to do things. So you be very observant. That's the first thing. Sure. Number 2, talk to people that are involved with the Benjamin Rush Institute. You'll be surprised there are people in your school, and go online and the internet has just created this like wonderful resource of things over there. Get involved with people that are like-minded, like you. Okay. And then the third thing, come out to a conference. I mean, you'd be surprised. We sponsor a lot of students. If you're really interested, we will get somebody to sponsor you to go over there. There are doctors that want to help you learn about this, because you're not going to learn it anywhere else. And mentor, or find a mentor in your community. Yourself, like Dr. Aguila, like myself. Come to our office. You'll see how our day-to-day routine is. We're both surgeons. This idea that surgery cannot be direct care, that's out the window, because we both have been successful with that. And I think once you start learning the ins and outs of how the processes go in medicine, which again, you're not learning in school, it makes much more sense with it.
Sure. Awesome. And, again, in terms of the conference, we're having our annual Nebraska FMMA conference on the 21st of August, 2026. So if you have got an interest in that, reach out to us. We would love to see you here, whether you're a medical student, a resident, somebody who's already in practice, or somebody who's even just thinking about going into medicine.
Right. And that's a big thing. You hear all the stories about we're losing doctors, and there's going to be a shortage of that. As we get older, I want good people to, number one, stay in medicine. And I want to attract good people into medicine. And, more than 42%, I think it was up to 58%, the last stat that I saw, of doctors are not wanting their children to go into medicine if they have that.
Yes.
Which, again, as a doctor's kid, my parents didn't really push us to that way, but, definitely was encouraging with that. But at any rate, yeah, so definitely get involved. Go there. The next FMMA conference will be in 2027, and you'll hear all about that on social media.
For sure, for sure. So, Grace, how can people find you? How do they reach out to you?
So I'm accessible online. Look up at Dr. Grace DPM. I usually hang out on Instagram, LinkedIn, and X. And so you can just Google my name. You'll find me there. I actually have a bunch of resources on my page, so that will connect you that way. Go on Amazon and buy my book. Or if you want to go directly, which is cheaper, I have a direct link to my book also through BooksBuy. I'm easy to reach.
Awesome. Well, thank you so much for being on the direct care movement. It's been a joy having you again. It's always great to reconnect with you. I'm really hoping you can make it to our conference.
I've already marked it down, and so
awesome.
I will definitely. I need just more details, and we'll get a format there.
For sure. We would love to see you here. Thank you for joining us on the Direct Care Movement podcast. We're excited that you joined us, and we're looking forward to having you join us in future episodes as we dive into more questions and more concerns and more solutions in the direct care space, whether it's direct primary care or direct specialty care. If you liked what you heard and you want to know more, please click like and subscribe and leave us a review. And don't be afraid to reach out to us directly so we can get you more information about direct care, whether it's direct primary care or direct specialty care.